continue our speak about instrumental delivery. Now I'm going to talk about ventouse, okay, or the vacuum delivery. What is ventouse? It is a cup-like instrument, okay, like a cup-like instrument that are held against fetal head and apply suction to tract and deliver the baby. So the idea behind ventouse is to apply negative pressure, okay. It is a suction, cup-like suction, okay, that held against the fetal head. Here is the fetal head, and apply a negative pressure of about 0.8 kilogram per centimeters, okay, to deliver the baby. I think I have a picture here. Okay, so this is the ventouse, cup-like instrument that are held against fetal head and apply suction to tract and deliver the baby. Okay, there are many types of ventouse according to the material that it is made of. Okay, we have a plastic ventouse, soft ventouse, rigid ventouse, okay, sometimes rubbery ventouse, or like this. Okay, ventouse applying should be preceded by a flexion of the head. Okay, why to flex the head? Flexion of the head before traction to have a smaller diameter of presentation, okay, and the distance between the posterior edge of the ventouse and the anterior fontanelle 3 centimeters. What does that mean? Let's just get back the picture. Here, this is the posterior end of the ventouse, and here is the anterior fontanelle. The distance between these two should be 3 centimeters at least. Okay, so this is another. What are the advantages of ventouse over forceps? The ventouse can be used in unknown position. Okay, it is acceptable here because if you remember in the instrumental delivery forceps instrument, we said that it is a prerequisite to know the position of the head before applying the forceps. But here in ventouse, no, it is not a prerequisite. Okay? Ventouse, as it's clear, it does not occupy the space adjacent to fetal head. In forceps, this is the forceps. This is the arms of the forceps. They just occupy the space adjacent to fetal head. This is the fetal head, and this is the space between the forceps and fetal head. It is occupying the space. But in case of ventouse, it just apply to the scalp of the baby, okay, without occupying the spaces. So this is another advantage of forceps, of ventouse over forceps, and it has less maternal injuries, less maternal third and fourth degree laceration. One of the most important complications of the instrument of the forceps applying is third and fourth degree laceration of the vagina. This is not there in ventouse. So these are the advantages: less maternal injuries, unknown position is acceptable, and does not occupy the space. What are the disadvantages of ventouse over forceps? We have what we call cup pop offs. That means that the cup of the ventouse can pop off. So what does that mean? If we have excessive traction on the ventouse, excessive tract, we attract in the excessive power, then we may have a sudden decompression of the instrument, and the sudden decompression of the instrument may be interrupt with the succeed of the process, okay, of ventousing. So this is the first disadvantage of over forceps, because in forceps it is stable, okay, it will never pops off. Higher fetal morbidity. What type or what kinds of morbidity? Scalp trauma, cephalohematoma, subgaleal or interventricular hemorrhage. Actually these subgaleal and interventricular hemorrhage are rare. Cephalohematoma maybe happen, okay, but if it happens, subgaleal and interventricular hemorrhage, they are dangerous. So in ventouse we have a higher fetal morbidity. In forceps we have higher maternal morbidity. Okay, in ventouse we should not know the position of the head. In forceps we have to know. In ventouse it is not that stable. When we may have decompression of the instrument, and it does not happen in forceps. Okay, so the scalp hemorrhage or scalp hematoma, the cephalohematoma, may lead to jaundice of the baby due to hemolysis. What are the indications of ventouse? They are the same as forceps, but the distinct thing here is the failure rate of ventouse is more than the failure rate of forceps. Though now ventouse usage is increasing, whereas the forceps using is decreasing. Okay, so fetal distress is the first indication in non-assurance CTG, a prolonged second stage, and maternal distress. We discussed that in the previous video. You can go back and review them. Okay, what are the prerequisites of using ventouse? Just like forceps, also adequate pelvis, the fully dilated cervix, rupture of membrane, engaged head. Okay, but not we should not. It is not obligatory to have known position. Okay, but the very important thing here, the baby should be on term. Okay, we don't use ventouse in preterm babies, and because behind that is a preterm babies is more liable to have cephalohematoma and scalpel injury than term. So the added point of a prerequisite here is to have a term baby. Forceps, it is not requested to be term baby. What are the complications of ventouse? We have fetal complications and maternal complications. Maternal complications is interruptment of vaginal tissue between the cup and the head. You can imagine that. Okay, this is the cup and this is the head, and here we may have interruptment of vaginal tissue that may lead to vaginal laceration. This is rare. Okay, it is not as much as in forceps using. Okay, and for fetal complications we have cephalohematoma, as we said. If we use ventouse for more than 10 minutes, we may have subgleal or intracranial hemorrhage. Okay, these are dangerous, may lead to fetal death. Thank you very much for watching. See you in the next video talking about cesarean section.